الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Hemorrhagic dengue fever by Professor Mahmoud Hani Sulaiman. Identification. Severe acute viral febrile illness endemic in most Southeast Asia shows vascular permeability, hypovolemia, abnormal blood clotting, mostly in children, moderate but severe in adults. Moderate in children, severe. Clinical picture. Biphasic illness in child, fever, mild upper respiratory complaints, anorexia, facial flush, mild GIT disturbances. With defervescence, increased weakness, severe listlessness, facial pallor, increased sweating, and circumoral cyanosis, cool blotchy skin, weak rapid pulse, hypotension with narrow pulse pressure. Hemorrhagic type include frequently petechiae, positive tourniquet test, easy bruisability, less epistaxis, bleeding gums, GIT hemorrhage, liver enlargement, epidemics, fatalities 50% in untreated patients, 5% if treated. The tourniquet test, inflated blood pressure cuff to point midway between systolic and diastolic pressures for 5 minutes. A test is positive when 10 or more petechiae per 2.5 centimeters observed. In dengue hemorrhagic fever, test usually gives a definite positive result, more than 20 petechiae. Test may be negative or mildly positive during phase of profound shock. Dengue shock syndrome, all the above criteria of dengue hemorrhagic fever plus signs of circulatory failure manifested by rapid and weak pulse, narrow pulse pressure less than or equal to 20 mm mercury, hypotension for age, cold and clammy skin, restlessness. Disease course. Dengue hemorrhagic fever with dengue fever has an unpredictable course. This is very important. It is a serious disease. Most patients have febrile phase for 2 to 7 days, around 1 week. Then critical phase around 2 to 3 days happen. I told you at the beginning it is biphasic. Fever phase, critical phase. During this phase, patient is afebrile and at risk of getting dengue hemorrhagic fever or syndrome, which is fatal if prompt and appropriate treatment not provided. It is very important to apply promptly appropriate treatment. Arrangements for rapid and appropriate treatment should always be available, so the case fatality rate can be decreased. Disease course of DF or DHF is summarized in coming figure, which I showed you in the last presentation of dengue fever. Dengue patient observed complications at least 2 days after recovery from fever. Due to life-threatening complications often occur during this phase. So we observe the patient for 2 days after recovery because we are fearing of complications. Patients and household should be informed that severe abdominal pain, black stools, bleeding into skin or from nose or gums, sweating, and cold skin are danger signs. If any of these signs is noticed, patient should be taken to hospital promptly. Diagnosis, as we said before, leukopenia, relative lymphocytosis, platelets less than 100,000 per cubic millimeter, elevated transaminase, prolonged prothrombin time, low level of complement of C3 complement protein, IgG, IgM in those less than 1 year old, virus isolation during acute fever, by inoculation of mosquitoes or vertebrate cell culture techniques. Differential diagnosis: arthropod-borne viral fever, measles, rubella, systemic febrile illness. Causative agent, as we said before, immunologic types 1, 2, 3, 4, they are flavivirus. Occurrence endemic in tropical countries, transmitted episodically in monkeys, urban dengue in man. This is the distribution of dengue. As we see, in green is the dengue risk areas. Of course, this is South America and this is North America. This is Mexico. This is Brazil, for example. These are the places where the risk is high. The other, no known risk for this disease, dengue. In Asia and Africa. It is not like yellow fever, not present in Asia. It is present in Asia. These are the countries in Asia, for example, India, Malaysia, Singapore, here in Saudi Arabia, in Sultanate Oman, in Sudan, which is related to Egypt, and Saudi is related to Egypt. So there is danger to introduce it into Egypt. Reservoir of infection: man mosquito, monkey mosquito complex in Southeast Asia and West Africa, transmitted transovarially in several species of Aedes. This is the Aedes aegypti again. This is the man-arthropod-man cycle. The arthropod bite, give the disease to man, then when man infected, it bite it again and take another mosquito, take the virus. Animal arthropod man cycle: the animal give it to mosquito which transmit it to man, and another mosquito, and this mosquito bite another animal and cause its infection. Mode of transmission: bite of infective Aedes aegypti and other Aedes species. A day biting, increase biting 2 hours after sunrise to 2 hours before sunset, like dengue fever and yellow. Incubation period about 2 weeks, commonly 10 days. Period of communicability: patients infected for mosquitoes 1 day before fever to its end about 5 days, like dengue. Hemorrhagic dengue, like dengue. Mosquito infective to man 12 days after blood meal and remains so for the life of the mosquito. Susceptibility and resistance: recovery from serotype leads to homologous immunity of long duration but not heteroimmunity. Even may exacerbate second infection. Hemorrhagic type. Pathogenesis: heterologous dengue antibody promotes infection of mononuclear phagocytes and formation of immune complexes, enhanced virulence of dengue strains, and human genetic susceptibility play an adjuvant role. In endemic areas, prevalence of dengue antibody is high in older children and adults, so it is more severe in this group. Preventive measures: health education for public, destroy the same as dengue, destroy breeding sites, and for mosquito the same like dengue and yellow fever. Protection from day biting. Community survey to identify density of Aedes breeding places. Implement elimination of Aedes. Control of patient, notify isolation. Blood precautions is important. Prevent mosquito access to patient. Screening insecticide net. No specific treatment. Control of contacts. Vaccination. Immunize population for yellow fever. It is the hemorrhagic dengue. For yellow fever if dengue occur near jungle foci of yellow fever, because urban vector for both diseases is the same. Urban vector for both diseases is the same. Investigate contacts and source to determine place of patient during fortnight before onset and search for unreported or undiagnosed case. Control of environment. Look measures for mosquitoes in yellow fever. Epidemic measures. Aedes search for and destroy larvicide applied to all potential breeding sites. Repellents for exposed persons. Airplane fogging and spraying with insecticide. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good watching.